Hello, I'm Dr. Teresa Caraway, CEO of Hearing First, and welcome to our Facebook Live AMA. We're broadcasting live today from Denver, Colorado, and we're glad you're joining us. But I'm especially excited because my good friend Joanna Smith is here joining us. She's the CEO and Executive Director of Hearts for Hearing in Oklahoma City. Welcome, Joanna. We're excited to talk about what it means to have a collaborative team to teach babies who are deaf to learn to listen and talk. So can you kind of tell us that as you work on a collaborative team, what does that look like on a daily basis? What does that look like in practice?
Communication. I mean, I think it is so important that we know what that child is telling us. And the only way to do that is to communicate, first of all, with the parents, but also directly with the provider. It's nice in our situation because we are there working together with the family and we're in and out of sessions. A LISL professional might be in the booth supporting the baby, making it their job as an audiologist much easier, but it also may be within a session when we are pouring ear molds and coaching a family on how to keep them in. So it happens organically where we are. That doesn't always happen. If you're a provider, you may not have access to that, so it has to become more intentional in terms of how we communicate.
Yeah. So you're actually doing a lot of co-treating then.
Absolutely.
In your collaborative team. That's fabulous. That's great. So, you know, you mentioned that sometimes providers aren't under your same roof. Do you have any suggestions, or you probably work with other professionals that are outside of your roof as well that are beyond your flexible team boundaries?
We do.
How do you make that work?
Well, it's more challenging, but it also it's very important because the family needs to know that the people that they've entrusted their child's care with are communicating. One of the things I think that can sometimes get in the way is assuming that the parent is the person that needs to be communicating between the providers, and that's an awfully big job. So we are all about intentionally reaching out to the provider. If it's an audiologist that is not in our center and we're communicating, it has to be directly with them. So it's either via email, certainly calls are the most effective, but it has to be intentional.
Yeah, and because there's key information that needs to be exchanged between each team member. As a listening and spoken language specialist, we're providing information about those functional auditory skill development. Audiologists are telling us about access to their brain, what sound, making sure that that child has access to all the sounds of speech, and we're monitoring that. And parents are helping us too, right?
Absolutely. Yeah. And we've been focusing a great deal recently on the bond, the attachment that a parent has to a child, and that what we learn from families in that area actually helps the audiologist to know how to engage the family. And so using those skills even with audiologists or professionals that aren't in our little network.
Yeah, it really, so what a collaborative team really does, everyone is focused on the child, bringing their best efforts to make sure that that child can maximize their outcomes.